We're back now. I hope everybody's back with us. Hopefully the CITV is back with us. Ms. Jackson, so we were starting with you. Can we talk about the overall strategies? What is it that got us to where we are now? And, in terms of being a very sort of, we've managed to mitigate the threat of Corona so far. But we are entering a new phase with, the airports have opened and schools are going to be reopened. So, can you talk about the basic strategies that have helped us so far and what the strategies are going to be when the schools reopen and how the school strategies sort of align with the national strategy? Sort of broad strokes, if you don't mind.
Okay, thank you. Thank you for that, Mr. Johnson. Yes, so essentially, the COVID prevention strategies have consisted of face mask wearing, hand hygiene and respiratory etiquette, and physical distancing. Those are some of the really important ones. The other part was important contact tracing and identifying persons through the testing program. So how that applies to schools is that we take those strategies and some more and apply them to the school setting. So we anticipate, we've made the recommendation for continued face mask use, and that's especially for the adults and for students that are in middle and senior school, and those at primary and preschool might use them coming to and from school, just when they're in the public domain. And then the old-fashioned hand hygiene. This is tried and tested, and good thorough hand washing and use of good thorough hand washing at all points in our activities will be encouraged, as will respiratory etiquette. And so respiratory etiquette really is the, sneezing into your elbow or using a tissue and disposing of the tissue. Physical distancing is a really important one, and we still say ideally at 6 feet, but we recognize that there will be times where 3 feet will need to be accommodated for. So again, in combination, you want to make sure that mask use is important during that time when you're not able to keep the physical distancing. But physical distancing is a really important strategy. The other strategies, the broad level strategies, include environmental sanitation. Now that's really about cleaning and sanitizing all kinds of highly touched surfaces. And then ventilation is another strategy, ensuring that we have good air circulation in and around where we are. Some of the things that also become important to us as individuals is when we start to screen both staff and students when they come into the school. And we have a screening protocol that we'll be using that will include temperature taking, but it will also include questions that we ask to try and identify anyone who may be a possible source of infection for COVID-19. Other strategies include staying at home if you're sick. And this becomes really important because when persons are unwell, we don't know what they're initially unwell with. So we have to try and ensure that it isn't COVID-19. And so that staying home, goes against what we've often said before, because we often get up when we're not well and come on, soldier on to work. And that was considered good work ethic, but we really do want to make sure that if you're unwell, that you remain home. The other big concept is the bubble concept, and that bubble concept isn't limited to schools, because we've also encouraged that bubble concept for persons in their workplace and in their household particularly. So having the same groups of persons that will remain together, and that will help us with what we think will, if we should need to do any contact tracing, if somebody has been identified or diagnosed with having COVID-19. So those are your broad strategies. The other big thing we'll want to do is monitoring health, and also communicating when we have an outbreak, and actioning some things that need to occur if we should have an outbreak. And that is still work in progress, but that will be an important part of our strategy when schools return. So I think I've outlined quite a few things there. So in summary, they do include our face mask use, our hand hygiene, respiratory etiquette, physical distancing, the environmental sanitation and ventilation, screening persons before they come into the school, managing if they're unwell in the school, creating bubbles, and our communication and surveillance around ill health in the school facility themselves.
So basically, if somebody's ill, they just shouldn't come to work. If a parent brings a child to school that's not well, what happens? They get sent home?
Yeah, so when we do the screening, when they come into school, we'll be checking their temperature. And if their temperature is at a high level, we have a threshold for that, greater than 38 degrees centigrade, then they would maybe sent home. And if they answer yes to the questions about having any symptoms, then for children, we're really looking for respiratory symptoms and a fever. So if they should have those kinds of symptoms, or if their household or a member of their household has been in contact with somebody with COVID-19, and if someone in their household has actually traveled and recently, so within that 14 days. So those are the areas. And as you mentioned earlier, we have our vulnerability are our borders, and there are a lot of efforts to try and contain and prevent any spread of COVID-19. But we do know that is our vulnerability from travel. And so that's why we consider that an important area to try and rule out any risks.
Right. Now, these strategies sort of differ by school level. Can you or Miss Beach maybe want to take that? Can you, one of you, explain why we have differences according to whether somebody is in primary school, preschool, senior, or middle?
I'll answer initially and I'll hand over to Ms. Beach, but essentially, each of the strategies have their strengths and they also have to be age appropriate for their population. And they also have to be implemented and can be implemented. So we have a greater emphasis on one strategy or two in one setting and one or two in another setting. And so you rely, for example, on middle and senior schools, you have to rely on greater face mask wearing and trying to do the physical distancing. For younger children, pre and primary schools, you really want to rely on creating the bubbles so that they have some opportunities for free play. We really do believe children will need that free play, but if we can keep them in small enough bubbles, reducing their exposures, then that can be that safe environment. So I'll hand the rest over to Ms. Beach, who may speak to more of those aspects as they separate between the different levels and school levels.
Right, Miss
Thank
Beach?
you, Nurse Jackson. Thank you, Mr. Johnson. So in the preschools, well, first of all, we look at the protocols through sort of a developmental lens. And so the younger children would obviously have less cognitive abilities to manage themselves as far as being able to wear masks all day or even a greater portion of the day. But even as we move up through the different year levels, middle school students and senior school students who would better be able to manage wearing the mask for longer periods of time, they will still have breaks during the day where they could unloop one of the ear loops and breathe and get more oxygen in, and that will facilitate learning as well. As far as physical distancing goes, as children get older, again, their cognitive ability, cognitive maturity, they can better understand. And we're not looking for a black and white situation. This whole pandemic has made us really realize how flexible we have to be. And the protocols by nature are very flexible. You may hear us say agile or nimble. In other words, a school can look at the protocols for their school level and sort of fine tune them for how they would work in their environment. We could not possibly think of everything, but the wonderful thing about the protocols is everyone's voice is in the protocols. By everyone, I mean teachers who were on their COVID response team back in February and March. Their voices are in the protocols. So whatever school level a COVID response team represented, those ideas were put forward. And ideas were in the form of mostly what are the risks that are in our school? So slash at our school level, and then how to mitigate them. So all of those ideas have been sort of mishmashed like a fruit salad, and they're in the protocols as well. So really the protocols are relevant for each school level and based on, of course, best practices from the Centers for Disease Control and Prevention, the World Health Organization, and Public Health England, and even the Pan American Health Organization, which is the Pan American arm of the World Health Organization. So the protocols for each school level were not pulled out of the air. I'll even say that the trade unions had representatives on our walkthroughs back at the end of May, and we'll know who they are. They're all affiliated to the school system. So, and as time goes on, parents' voices may be a bit louder in the protocols, and of course, more teachers. So, we're just gonna the protocols will morph as we learn more about the COVID-19 and what our protocols look like in the school system.
Great, thank you so much. Just our Facebook audience, I do recognize you got some questions there. Um, I'm coming to those in a minute. Now, Mr. Casey, the um, the health people have said that environmental sanitation, the hand wash and everything is really important. Now, you as the facilities guy for the system, you must have been quite busy. Tell us a bit about how prepared we are. What has been going on in the schools?
Um, Thank you, Mr. Johnson. Behind the scenes, we have been ordering supplies, um, more supplies than usual, and prepared for COVID-19, right? We're going to be washing our hands more frequently. We're going to be sanitizing desks, frequently touch areas more often than normal. So the supplies we have ordered now, the stores is fully stocked, but we'll be ordering just as they come in, we reorder. So we're going to ensure we're always got an adequate supply of sanitizing wipes for the younger kids. Also for the primary school students, we're going to have sanitizing stations outside the schools. Public Works has actually put those in, or we're installing those now. It's a lot going on. Decluttering the classrooms, we done that a few months ago to
Okay,
ensure we have adequate space in the classrooms. Um, I've been working with Ms. Beach tirelessly, and we feel that we've got it, and we are prepared, fully prepared.
great. Now, okay, so there are some questions about physical distance in the classrooms.
Yes.
I guess we should probably go back to our health officials on that. But you said you presided over decluttering classrooms, so there's more space. Um, but for Miss Beach or Miss Jackson, what is the rationale and what are the parameters around the space, the distancing issues?
Well, when we first started this part of our journey during the COVID-19 pandemic, Mr. Casey, myself, some school nurses, some school principals, teachers, and the union reps, we made our rounds through certain schools. We did one school at each level. We did one preschool, one middle, one primary, one high school, senior school, and Dame Marjorie Bean Hope Academy. And we were looking at the spaces before decluttering occurred and after decluttering occurred. And so we looked at the spaces through sort of two lenses. What does a classroom look like in with less furniture and less decorations and what have you? Thinking of the air quality, so that is a big piece of safety and health, even outside of COVID-19, outside of any infectious disease, the air quality. Research shows that the better the air quality, ultimately we can have better academic uh, performance overall. So that was one lens. The other lens was the COVID. So we're looking at space considerations. And way back in April, May, even into early June, we were looking at a ratio of approximately one teacher to a maximum of 10 students in a class with a room of dimensions approximately 20 feet by 25 feet, looking at, okay, with the physical distancing still being at 6 feet, how many students could we safely get into a classroom? So that was the start of the journey. So we have moved ahead, but really our ability to look at the schools over the months has been really influenced by what's happening with the COVID-19. We're not just arbitrarily saying, let's change this, let's change that. We're looking to make sure that any expansion that we see in the community, which would be guided by the Department of Health, can that work in schools? So schools have been rated as being a medium risk setting or medium risk settings. That means we really can't treat them exactly as we are the public in some areas, some respects. So I'm going to let Nurse Jackson take off
What
from
kind?
here.
I mean, I want to hone in
And
on this issue of physical distancing because there are some people who are a little bit concerned. Um,
yeah,
Not every classroom is going to have 6 feet between each student.
that's true,
Well,
Mr. Johnson.
yeah.
Okay, you can go ahead, Nurse Jackson.
Yeah, that's good. That's correct. There really isn't. And I think what Ms. Beach is saying is that we also have to take into the context of what's happening in the community and the amount of COVID-19 in the community, so that the risks associated when we're not able to realize 6 feet are very different than if you have community-wide transmission. And currently we don't have that community-wide transmission. We have most of the cases are important. I know there is some investigation on one or two of the cases, but they are either linked at this time or they've been imported at this time. So we do have to look at our context. So the need for the 6 feet will definitely need to apply. It's the ideal, but it can be if you're 3 feet, and that's where you really want to encourage the mask use for the adults. And we have to consider transmission of COVID that's likely to occur more between the adults or older adolescents than it is from the younger children. And that would be suggestive of some data around transmission. So that's why there is some flexibility and the recommendations, but they do have a context in which they need to be considered. And I think what we've been saying all along with the protocols is that we have to have the flexibility and the change. And it has to occur based on two factors. Number one, any of the evidence that comes out and our context. So the level of transmission of COVID-19 in the community. And this journey, as Ms. Beach said, it really started several months ago, and we've seen a lot of information that has come out, and more information will come out. And every country has been grappling with strategies for how they implement, and what that implementation looks like, depending on the other factors like the levels of COVID-19.
Okay. So if somebody was to ask, as somebody has done now, what is the recommended distancing in classroom at this moment in time? Is the answer 6 feet without a mask, or is it 3 feet with a mask, or what?
So we still want ideally for 6 feet, and when we cannot arrive at 6 feet, ideally with 3 feet. But we have to recognize with the younger children that may not be, they're going to be doing free play as well. So with the younger ones, you still wanted to be using hand hygiene, good
Yeah.
ventilation, and mask use amongst the adults.
Okay.
So
Yeah.
back to all those different strategies.
What kind of air quality assessments are happening now and how frequently? That's a question from Facebook. Mr. Casey, do you have an answer to that?
Air quality testing is normally taken if there's a problem in that room. Say we've got a roof leak, something's going on in that room, foul odor, we would do the air quality testing then. It's
Okay.
not like we test every room in every school just to test it. I'll say that.
Can you talk about the ventilation then? Um, uh,
Ventilation, we've had a program um, with Public Works to ensure all windows and screens are operable. So that would mean that they're going to go out and service every window to ensure that it's operable where they can use and get fresh ventilation.
okay.
Screens in for the insects, the windows to be working for the ventilation.
What about the air conditioners? Are
Air,
they recommended as like ventilation for our purposes?
air conditioners can be used.
Yeah,
The filters would have to be frequently cleaned. They can still be used by the health department.
yeah,
Um, so we still be using them in some cases. Some rooms don't have windows that are operable. They might have skylights in a few schools, limited, but we do have that also.
right. Now there's a comment here. I think. Can you all see that?
I can't see
There's a
anything.
comment and a question. It's we're now showing cases of local transmission. What is the plan should there be an outbreak in a school? Okay, are we showing cases of local transmission? Miss Jackson?
I I think I'd have to look on our website. I do know there were two under investigation for how the routes of transmission, and so that's probably on our website. But I think it's a valid question in terms of when we have cases and if we have a person who is confirmed with COVID in the school system. But let me just backtrack a minute or two just so we understand our community transmission. There are three different levels. You've got
Yeah,
the imported, which we know is the most frequent at the moment. Then you have clusters of cases, and that's what happened earlier in the pandemic in Bermuda, where we had persons who were known within groups of other facilities that were found to be positive for COVID. And then you have community-wide transmission. And fortunately, and I'm not good here, we have not yet been to community-wide transmission, and that requires us to have had persons with COVID-19, and we're not even sure where it came from, where their source of infection came from. So we're not, and that's usually a widespread definition that they use for that. And so as we move forward, even if we have any case in the school system, we will look at, and we are in the process of developing an outbreak plan. And our responsiveness to that will be really, really important. So part of that plan will include identifying anybody who was exposed to the person who was confirmed to have COVID-19. And that's why we have an emphasis on the bubbles. So basically, we would be informing the persons in that bubble that they will need to be quarantined and they will be monitored. And anybody who is positive with COVID-19 will action our epidemiology and surveillance unit, who will do an investigation, and they will lead that investigation. But communication will be very much a part of that in the school system and those who are directly affected. Now, I want to be clear, we won't necessarily be calling anyone's name to say, oh, this was little Johnny who was positive for COVID, where that's not going to happen. What you will do is get information about your potential exposure. And so we do ask that parents and everyone provide up-to-date information for easy contact, and that will be an important part to that. But that's why we want to strengthen the use of bubbles so that if we do identify a case, we actually know who we can contact very, very quickly. That once they are informed and they're quarantining, then our testing strategy will be considered. And that hasn't been fine-tuned yet because people will be expected to quarantine, monitor their health, and then the testing will be done based on an assessment of the risks at that time. So those are the steps that will be from an operational perspective, but from an end user perspective, as in staff and for students and for parents of students, if your household has been affected, then we will encourage you to participate and you will get more information about next steps and about monitoring, because that will be a part of our role in ensuring and trying to prevent any further spread. So
Okay.
we will need to be in a state of preparedness. But again, it's guided also what's happening in the broader community and the number of cases that occur in the community.
Okay, there's a question on the screen, but I'm gonna if Miss Had Ferbert could hold on a second. There's actually a really important question because we've talked about screening and asking all those questions. And somebody's saying she's not comfortable with depending on the honesty of others when answering questions pertaining to possible exposure, whether someone is ill in the home. Yeah, that's a scenario, isn't it? I mean, not everybody's going to be honest. A parent
Yeah.
leaves home, sends a child to school. You know, her job is his or her job is in jeopardy if they keep going back and forth. What do you say about that? Have we seen dishonesty so far in a wider society? Because schools are a microcosm of a community, really, aren't they?
You're quite right. Yeah, we reflect anything else that's happening in the society, and I would say two things. Number one, if we're going to prevent COVID-19 from spreading, it's all of our responsibility, and each of us have a role to play in that. It's our collective role. In terms of what we found with compliance, we have found a high level of compliance with most of our recommendations when persons have been found to be confirmed with COVID-19. You may occasionally have somebody who is not entirely honest. That's human behavior. But here's what we have to work with is that if most of us do most of the stuff most of the time, it actually reduces the risks for the odd person who doesn't. And I think what I would say is that we've seen a high level of communication of persons from the community when they have perceived others not being compliant. So
Okay.
we've had, when I say policing, I'm not talking about the police per se, I'm talking about other people policing others. And so this has really been a really effective community response. And I think it's important if we can continue in that vein,
Right, but you
because
didn't.
that will make a difference.
Gotcha. You did not mention that as a strategy. Is that now a strategy that we're recommending that people turn other people in? I mean, it's a
So
public
that
health
was
issue.
operated some time ago. There was I think there was I'm trying to remember, there was a telephone line number for
Yes.
persons who are not compliant. So that wasn't our strategy, that was already an established one from the country strategy. Yeah,
Okay, and that's still in place.
that exists. That already exists.
Great. Okay, can we talk about the evidence around, 3 months ago, children didn't transmit it. Now we're talking about some children have the same, or Ms. Ferbert is saying a higher viral load than adults. What's the latest data on this?
So children, I think there's the viral load is about the ability, well, let's keep that simple. When we talk about infections, we know that children may get the infection, but their burden of illness was never considered to be very, very high. Children have thought to have been responded well and gotten over the illness. That didn't mean that they didn't really have it, but that's why it's the transmission between children has been low, because they've thought the different loads and the amount of virus that they need to transmit may be different in children, which might account for why there's not a lot of obvious transmission or response. But I think the data is still emerging as it relates to that. I think it's still, people are always baffling themselves about, why aren't we seeing it and why isn't it happening? But the data would suggest transmission is greater in older adolescents than it is in younger adolescents. As to viral loads, and as to pre-symptomatic and asymptomatic
Mm.
transmission, which is what we're talking about, there is still much information around that, and some really wonderful literature on that that people can review. But it is from what I looked at recently, there's still some inconsistencies, so they're still pulling that together. And they have what you call a systematic review of that data. And so people can go and Google that. But that's really the evidence that is and will be emerging.
Let's talk about testing. We've done very well with our testing regime. Um, question here is, will teachers be tested for COVID before the return to work? Yeah. What's the point of not testing teachers if they're going to be around people's children?
So if we look at there not being community transmission, to test a teacher today and say, oh yes, everything is okay, a test really only tells you that test at that moment in time. And in the absence of community-wide transmission, doing a strategy just before we go into school may not be that helpful. But certainly if people have been in household or have been in contact, then people can actually sign up for their own testing. But to implement a wide strategy just before school may not be of that much benefit with us not having widespread community transmission. But testing is important, and it will be important if we have a confirmed person with COVID-19 in the school system.
Okay. Right. So if we do get to a point where there is community transmission, what next? What happens then?
Yeah, that's a changes a lot of the parameters, and that's really would be guided by our epidemiology and surveillance unit, because it really does change a lot of the responses. And let me give you one example of that. When we see children who have influenza, for example, in the early parts of the influenza season, we'll test them all the time and find out who has flu. But when you're in the midst of the influenza season, you have everybody in, then the clinical assessment about that flu and the reporting may be different. So what we would do in the first instance is really look at what's happening and what's the spread of it occurring, to know who can then be tested. The other big thing that we need to be aware of is what would be the impact on the hospital, and what is our ability to treat people or have people in hospital if they've been affected by COVID-19. And that includes children as well as adults. So those are all the factors that come into play about when or if we have community-wide transmission. But I think a lot of our efforts are trying to reduce the risk of community-wide transmission. We won't eliminate all the risks. This is a disease that's occurring in all parts of the world. But what we're really trying to do is reduce the risk, identify anyone who is positive so we can contain and prevent the spread.
Okay, give you a bit of a break, Mrs. Richards. There's an issue with among some parents with custodians and cleaning. There's a sense that in some schools then there's not enough people, or their schedules are all over the place, and they're not going to be able to clean the place as frequently as they should. Um, is this something that you're comfortable about? Is this something that's being addressed?
The matter of ensuring that our schools are clean, that they are sanitized and disinfected is an imperative for us. What we wanted to do, and we are aware, and we've talked openly with the custodians, and I have talked openly with them about this variance across the system where, some schools are just kept, in pristine condition, and the excellence in terms of what the custodians are doing is evident. And in others, the level of cleanliness is a lot lower. And what we decided to do was to actually bring all of the custodians together with the support and assistance of technical officers from the Department of Health and Environmental Health, and to say to them, listen, this is the expectation for the system as it relates to our schools. We are looking for a standard of excellence with respect to cleaning that goes across all schools. We do not want to see a variance. And so what the Department of Health technical officers did was to take our custodians through a training session that involved them. It involved going through the custodian protocol in terms of what they had to do from the time that they get into the building, what has to be done on a daily basis, a weekly basis, a monthly basis, a yearly basis. And it's actually a form where they can tick what they have done each day. So we brought them together and did the training. And we actually took time at the end of the training to do what we called a brief check-in and assessment to see if our custodians did capture the key concepts and what was required from them, and they did. So that was a plus for us. We started to talk about, how do we ensure that custodians are set up for success and schools are set up for success as it relates to cleaning. And so it did lead us to a discussion around, okay, what about the hours for custodians?
Yeah.
So there are periods where they're off site, and so this week we're looking to have discussions around that so that we can ensure that we have a custodian present on site at all times. We do need to ensure that we have a strategy as well, because some schools will have one custodian present. The smaller schools, the preschools that did not have who only had night cleaners prior to school closing, will have daytime cleaners. And so we do have to have a strategy so that when that individual is out on a lunch break, and he or she has to have that break, how do we ensure that the frequently touch points and the ongoing sanitizing, cleaning, and disinfecting takes place? So we are, dealing with that. The expectations have been communicated, the protocol has been developed, the cleaning and hygiene supplies have been secured. They'll be going out to schools. We'll have discussions around, adjusting those hours so that we can ensure someone is always present on site. So that's going to be important. But the other thing is, we can have those expectations, but we still need to do the inspections. And so there will be a number of strategies, both formal and informal, to inspect, to ensure that the protocol is indeed being carried out.
Okay, so this are we going to know by the end of, or when we're going to know about the availability of custodians in, when required, in every school? Because it sounds partly like a labor relations issue. If people are being have to be covered for their breaks and all that kind of stuff.
Well, there are schools, and Mr. Casey can probably give an indication a bit more about the custodial services, but the larger schools, some of them will have up to 3 custodians. And so in a case like that, you can ensure that there are custodians on site throughout the day, continuing with the cleaning and sanitizing and disinfecting. There are schools that have 2, and so therefore we should be able to balance that. So where we have 1, that's where we have to look at how do we plug up that gap to ensure that when the custodian has his or her break and they are entitled to have that break, then what do we do, as a safety measure while that individual is on a lunch break? So that's where we are at this time.
All right, I'm going to jump to, I'm going to ask the Facebook people to be patient. There are going to be 2 more panel discussions after this. And I'm really trying to sort of focus on safety for staff and students. The others, there are other topics which we won't deal with here because of time, but they will be dealt with in the other panel discussion. But there is an important question here, or a statement, and I would like you, maybe the health people, to respond to this. Private schools appear to be doing things differently. Can we make sure, she says, can we make the public school system the go-to school system? There is an inequity and disparity which is glaring. In terms of our health measures, are the private schools any different to the public schools in terms of the basic strategies? And can Ms.
No.
Beach, what are you saying?
Yeah. No, they're pretty much identical. I've seen their protocols and we've shared our protocols with them as well. So they have plugged up any gaps if they had any by referencing ours. We have done walkthroughs. I've been to every one of them, sometimes alone, sometimes with the school nurse. Nurse Jackson and I have done a couple of visits together as well. So no, I'm sure to some people there is a great difference, but there really isn't. I can say for the private school principals that um, they just are able perhaps to pull things together a lot quicker because it's one site, or in the case of one of the private schools, two sites. And it's identical as far as the planning process, the contingencies for um, how the COVID-19 will flow. You know, everybody is thinking of the fact that we're in sort of an expansion phase now with the lack of community spread. Everyone is aware of what they'll have to do once or if community spread starts, identical to the public school system. So everybody, every school on this island has contingency plans in place. And when I say every school, that's DOE, Department of Education, and its 38 school sites, and the six private schools, well, eight now, and they're of varying sizes, so they're identical.
So you have their guidance that they're getting is from the same people, basically you and your colleagues, correct?
Yes, and they also had produced different versions of the protocols even before we met. Some of them had started doing some research in earlier February, and so we wouldn't have been aware of that. DOE had already started some investigations of its own in February as well. I just became involved with Nurse Jackson towards the end of March, but no, everyone's been doing their due diligence and everyone is citing the Centers for Disease Control and Prevention in the US. Everyone cites World Health Organization, Public Health England, and they're looking at other countries around the world who had opened their schools to see what worked and didn't work. But we also did our own literature review and we were doing the exact same things the public schools were doing. Everyone was trying to think of the safest way to reopen, how to protect the children, how to protect the staff, and that's everyone's goal.
Okay, can we talk about bubbles now? Because that's one of the strategies you've mentioned several times. It's not really a perfect system, is it? Because Patricia De Shields is saying they do not work for high school students because there's a different mix of students in almost every single class. If somebody has virus, the school will have to close. Is that correct? Um, their families with siblings in different school levels. So those bubbles are naturally going to mix. What's the mitigating factor around those uh, issues?
Yeah, I think that's quite a valuable point made there, and we understand that, and that's why the bubble issue um, can't be reliant upon as you get older when your circles are very changing. So you do have to rely then on the for the older ones, the mask wearing and the physical distancing. So no, bubbles are not perfect, but what they are, what we attempt to do with them, and what other countries have tried to do, is actually keep small groups of people together and the same groups of people before you then change that circle. And if you can keep some stability within that group, then you reduce your risk of exposure. But if you do a lot of mixing and mingling with any and everybody, the risks of exposure just by that mixing and mingling of a high volume of people will increase the possibility of you being in contact if there is somebody with COVID-19. So no one strategy will be fully effective.
Is that a plane coming or going?
It's just gone over, so
All
it's
right,
apologies.
no
um,
worries.
so the bubble, but the bubble concept is really important. But it's not just for the schools, because we've been asking families to have consider their own bubbles, limit who they're coming to the house, and when they have functions, keep in the same group. And then after an incubation period, really of the 2 weeks, then if you're going to change it, then you're changing it then. So yeah, it is work in progress. It's not the panacea, but we do think that it may help us certainly with contact tracing.
Yeah. Talk about plexiglass because this keeps coming up. And I'm not really sure where the department is on that. Are some people going to have plexiglass around them? This question is really about learning support. People have to have one-on-one interactions, close interactions with, or in smaller classrooms, para-educators, therapists, etc. Are there going to be plexiglass barriers in some cases?
So, Mr. Johnson, what I can share at this time is with our teachers who have to work closely with students, we're talking about teachers for the ASD programs, for functional skills, functional academics. Those teachers and paraeducators will work closely with students. So, the distancing will be a lot, it will be narrow compared to um, other situations. So what we will do in an instance, in those instances, is to provide the PPE, the personal protection equipment for individuals, the mask that they have, the face shield, not the plexiglass, a face shield, washable gowns, and then the disposable aprons that go on top of those, and the gloves. And we will also provide, and we've had discussions, we will provide training as well around what is the correct way to put on and to take off the PPE.
Okay. I do want to go back to the question about an outbreak because there's a question here about. I guess it calls for a bit of clarification. Can there be a direct and immediate line of communication between the Department of Health and schools so that as people test positive, we know which students have been exposed and thus should be quarantined? So I think the assumption behind there is that if the department contacts a school and says students A, B, C have tested positive, but is that? I mean, you've already explained how it should work in practice, but can you sort of reiterate that and elaborate on
So so
how it's?
basically, yeah. So basically, what will happen is health needs to be involved in that discussion primarily because of the next steps. It's also about the information that needs to go home, the information that needs to be understood. So people's next steps, whether in fact they have other household members, whether there's other provisions that need to be considered. Maybe they have vulnerable people in their household. And so that's why health would be intimately involved in that. But we also need to make sure that we maintain people's privacy
Yeah.
and respect their confidentiality. And so that's why health does stay in the forefront of the communication and be guided accordingly. So we want to have the information and access to information. And so that's why we ask parents and staff to ensure that they do have their information, contacts so that it can be as efficient as possible. And I think everybody considers the issue of COVID-19 quite a significant one. So it is on everyone's radar to be responsive. And so I think that we all have that interest for the students, for the staffs, for the family, and for Bermuda at large.
Okay, so health is going to lead on it. They will do all the contact tracing investigation, recommend, inform the people affected directly that they've been exposed, and recommend quarantine.
Yeah,
Um,
and that's no different from how we do it with other infectious illnesses.
yeah.
So yeah, it,
What? happens though when I'm just trying to follow the line of thought here. What happens if somebody who's supposed to be in quarantine shows up at school? Is it going to be flagged? Is it going to be recognized? Is there going to be a list somewhere?
So we have a screening process, and sometimes what we have is monitoring. So when we have people under active supervision, public health supervision,
Okay.
there is usually contact with persons, because we need to monitor their health. Because we need to find out who is having symptoms or who is not having symptoms. So that will be all a part of our outbreak plan and contingency, much the same as our epidemiology and surveillance unit do right now.
Okay. I'm going to go back to the bubbles again. Miss Phillips here is saying that you say the focus is on bubbles, but have admitted that bubbles are not feasible, and you're really talking about classes of up to 20 kids. The publication defines bubbles of 5 to 10 kids, which suggests that is the recommendation. Obviously, parents will be incredulous if you're going against your own recommendations.
So again, that was initially the 10 which is what Ms. Beach talked about earlier. That's where we started off at the beginning of the pandemic when the documents were first done. But we have to look at our context now, and we've been able to increase that we think might be a safer number. That could change though if we had community transmission. So that number has increased somewhat. For us to be able to realize that. That doesn't mean, though, that we continue to not try and keep some semblance of bubble, because I think for the senior school students, you still want them to try and keep within a bubble, but their bubble will look a little different than preschool, for example, or primary school.
And the point of the bubble.
They're also very social. Adolescents are very, very social. So you want them to know about their contacts and their socialization. And these are the decisions and discussions that we're encouraging parents to have, not just for the student and school, but even for their household.
Okay. And the point of the bubbles is to facilitate tracing in case there is anything, correct? Is that the sole?
That's correct. And reducing multiple exposures and contacts.
Yeah. But obviously, I mean, the point is, the larger the bubbles, the more risk there will be for multiple exposures, correct?
Well, the bigger the bubble, the more you have people who are, unless you're in one specific area, but remember, those persons go out to their homes, they come back in, and if they've gone to somewhere else and they come back in, that's where you have other potential sources. So
Yeah.
their bubble stays consistent, but it's what they do outside of that bubble, and that's why we talk about bubbles, not just in the school system, but in the at home as well, and in other circles.
What is the current maximum class size then? What's the recommendation for class sizes?
Right now, we're at 8 feet, but it's based on definitely the room dimensions would be a factor, but also Department of Health has looked at environmental aspects as well. So we're looking at the ventilation rate in a room, which has to do with a couple of things: the amount of circulating air in a classroom, as well as the number of people who are using the classroom. So it could be any room, but we're talking about classrooms. So where the ventilation rate is, or where there's less circulating air, there should be fewer people in a classroom. That's why when Mr. Casey talked about ventilation, he was talking about ensuring that every classroom's windows were functioning. And of course, we're pretty sure most of the classroom doors open. But if you can have the ventilation rate at a very high level, then you can theoretically have a few more people in the room. If you have an air conditioning system that isn't robust, where the ventilation rate cannot be increased, then you would have fewer people in that classroom or
Okay.
that room. So that's why we talk so much about the importance of having a robust ventilation strategy.
Right, but there's also a number in terms of, I mean, because somebody's here saying, are we still looking at classroom numbers to be a maximum 25? And what is the highest
Um,
class number in terms of primary school? Knowing,
we're looking at 18. It's 18 right now. We haven't moved from that quite yet, and we may not. We do understand it's a dilemma for all schools. All schools have at least one class, or just about all schools have at least one class that's has more than 18 students in it. Um, what the solution is to that, I guess that's still under discussion. But right now, the Department of Health, I wouldn't say we're comfortable at 18, but if we know that those other safety and health strategies are in place, especially the ventilation, but the hand hygiene, where any one of the measures can't be fully realized, in this case, the physical distancing, then the other measures have to be strengthened as much as possible. So 18 is sort of that magic number, more or less. That
yeah,
could change. That could change.
okay. Um, Fire drills and lockdowns. We haven't talked much about that. It's come up in a meeting or two. Mrs. Richards, or anybody, are there special procedures around fire drills? Because they have to happen.
Fire drills are mandatory, part of the safety and health procedures under, normal circumstances. And so the Department of Health, they have assisted us so that we do have protocols for fire drills and evacuations. And Ms. Beach can just share a little bit about, about those.
Thank you, Commissioner. Um, the fire drills will function pretty much as they do now. Classes normally do leave the building as bubbles, if we can say that. What we have put in the protocols is if a child's mask is not easily available, they're to clear out with their class and get to the muster point. We're saying the fire drill supersedes the mask wearing. Um, Classes typically reach the muster point and they have their gathering spot. Every class knows where it'll be, and that won't be any different during the COVID-19 pandemic. If schools feel like they need assistance, this Department of Health, but also the Bermuda Fire and Rescue Service, they would be able to lend assistance. And the Bermuda Fire and Rescue Service can be called on anytime to assist the school that wants to improve its evacuation speed and if the correct exits are being used and the whole process. So none of that will change in the protocols during the COVID-19 pandemic.
Okay, so now there's a question about the hand washing. How often, where was it? How often should students be hand washing and sanitizing?
Well, Nurse Jackson had talked about the different hand hygiene methods. So the protocols speak to sort of the 5-year-old and under children not using any hand sanitizer at any time. Everybody using soap and water the majority of the time, and of course, drying your hands completely to avoid touching surfaces and resoiling your hands or reinfecting your hands, picking up germs. But for the 6-year and over children, they could use hand sanitizer as an option if there's no soap and water available. Anyone who's allergic to hand sanitizer and they're not allergic to hand sanitizing wipes. They could use the wipes, but certainly soap and water would be the best. And actually, the protocols include recommendations from the World Health Organization, which outlines the frequency and opportunities that schools could find for hand washing. So transitioning from one activity to another, before and after you eat, um, after you use the bathroom, after you touch a surface with bare hands where you could possibly pick up germs that way. So all of that will be in the protocols if once people start to access them they will be able to read what they are, and eventually they'll become a second nature.
Okay, so how will school nurses? What's the plan for school nurses? I know that's a sore point.
Yes, that is a challenging point. We have currently most of our school nurses are redeployed, involved in the COVID pandemic preparedness activities related to the community. So I'm hopeful, though, that I will get some school nurses back. And in the first instance, the school nurses will really be involved in that surveillance that I talked about earlier, and monitoring the health of schools. That's what will be their first priority. So even if I get a few of them back in our pool of child health, then they will be involved in that way for the schools. So we will be looking at how we do things a little bit differently, and that is work in progress now as well.
Okay, Mr. Casey. Graham Smith says, what happens if a classroom has no air conditioning and windows can't be opened? Well, that's pretty drastic, isn't it?
It's
That's
pretty
like
drastic.
that's like a prison cell I was in once in
We don't
another
have any
country.
classrooms that don't have any windows or air conditioning. That's unheard of in the public system.
Okay, so that hypothetical doesn't exist. But I mean, are you
Doesn't
saying
exist.
okay? Are you saying all the windows and all the ACs are in good working order?
Most definitely.
Okay. Ah, faucets. I did get a question from somebody on Facebook saying their school had faucets that did not that you needed to keep open with one hand. Are they going to be changed? Because otherwise you're recontaminating the hand every time you wash your hand.
We've had this question before. What happens? You wash your hands in the restrooms. No, they're not automated. Once you get back to your classroom, you have a sanitizer. Each room's got a sanitizer. They re-sanitize their hands. So in actual fact, before you get in your classroom, you're going to have your hands re-sanitized again. That will ensure the teacher can see exactly what the students are doing. So you may wash it in the restroom. Your point, I take your point is valid. You're going to contaminate it again, but once you get back to that room, the classroom, you can sanitize your hands again with the dispenser.
Okay. And you're going to make sure every classroom has ample supplies of dispenser.
Yes.
Right. But with small children, is that the system is going to work? You know, I mean,
When you say small children, the preschools,
primary schoolers, 5-year-olds, etc.
the primary, the lower level students have wash sinks in their classrooms, a little bit different from the older students.
Okay.
So they can wash them in the bathroom, also in the classroom.
In all the primary schools?
Yes, the majority of them do. Preschools and P5s have wash stations in their classroom, sinks.
Okay, so there is a question. I'm going to allow this question. What's allowed in the way of decorating the classrooms? Because it keeps coming up, Mrs. Richards. So bulletin boards. You know, before school was out, paper had to be removed. So what's the situation now?
So, Mr. Johnson, what we want to ensure that there is consistency across the schools. So I did reach out to the technical officers at the Department of Health to get some guidance around what could actually be placed on bulletin boards. We really don't want to impact the quality of air. And so that's part of it as well. We don't want to, so I'm going to I'm going to ask Ms. Beach just to share some of the points, some of the key aspects of the protocols for bulletin boards. And I
Yeah.
did share that. I actually posted it for principals, so it's in a repository where they can actually download it and they can share those, share the protocol for bulletin boards with staff. Ms. Beach, if you can just sort of pull the key aspects for us,
Is your
please.
camera on, Miss Beach? Looks like you're frozen.
Oh,
Sorry?
am I on now?
Well, your camera's not
Yes,
live,
you are out.
but we can hear you.
Okay. Okay, thank you. Thank you, Commissioner. So Back in May or early June, the commissioner and her team, her technical team, looked at the policy for safety and health in a general sense in schools, and specifically around the classroom environment. And as we said, we did the walkthroughs pre and post the decluttering process. And one of the elements on the checklist that was used during the post cluttering process to sort of see what still needed to be done, one item was the bulletin boards, and that is in this environmental policy. And the point being that bulletin boards that are never changed, and by that I mean the background stays up for a year or two, the borders may not get changed. Over time, they do accumulate dust, but they can also accumulate some mold spores, because if a classroom is closed up for more than 2 or 3 days, the air is stagnant. And if there's a lot of humidity, paper products can become damp, they dry. That can cause the growth of mold. Maybe we can't see it, but oftentimes when we walk back into a room that hasn't been open for weeks or months, it smells musty. The air is polluted. So that is one reason why the directive went out for all bulletin boards to be cleared off, so that the framework, I guess, if it's cork or wood, can breathe. We are looking to improve the process of aerating rooms even during school breaks. Windows should still be cracked open to allow air to circulate, which can help to prevent a lot of the mold issues that occur in schools.
Okay, so
So
the teachers don't.
that's the whole process.
Okay, so teachers don't have flexibility in terms of putting up, stuff on the bulletin boards, etc.
So
No,
the
they don't.
baseline,
And the
Sister
other thing,
Sorry, go ahead.
I was just going to say very quickly that the policy also looks at the amount of decorations in a room, and it's as small as 20%. So we're just encouraging teachers. I know, goodness, I go to schools and I just say, wow, this is a happy school. You see beautiful decorations up. But we're just asking if it's student work that's being displayed, perhaps at some point around midterm or sometime, the work could go home instead of accumulating. You're not going to layer the celebrations if possible. I
Gotcha.
love seeing the celebrations when I visit, but right now the COVID is it's making us revise how we do things. It's not to take away all the fun. It's just helping us to improve the way we normally would do some
Okay,
things.
so there's two. Sorry, I got to cut you off because we've got 3 more minutes, and I know CITV has some other programming that they have to do at 7:30. I do want to follow up because when we were talking about the smaller children and their hand washing, Mr. Casey said that they will have sanitizer in the classroom as well. But are small children supposed to be using sanitizer?
No, he didn't mean that. He didn't
No.
mean that. He meant that the 5 and unders will be using sanitizing wipes if
Yeah,
there's no in-class sink.
Okay, so
correct.
Yeah, he
sanitizer
meant
wipe as opposed
Yes,
to,
correct.
yes,
and that's safe.
sanitizing wipe.
Wipes.
All right, that's safe for children. Is that made for children that young?
Yeah, that'd be like baby wipes, that
Okay,
kind of wipe.
gotcha. I needed to clarify that because
Mhm.
we got some very fierce advocate parents, as they should be, and they're not going to let you get away with contradictions. But you also said, Mr. Casey, that not all the classrooms have, or you said the majority of them had their own sinks in the classrooms.
In the preschools and
Yeah.
primary one
Okay.
and two. Yeah.
So, has consideration been given to have like mobile washing stations?
We've installed mobile wash stations in schools that have 130 students and more. So that's what we have done.
Okay. And there's a question about logistics. We've got like 45 seconds left. How will the teachers monitor the students coming from the bathroom if they're teaching or interacting with another student? Do we not need more staff in these classrooms to manage all of this? Mrs. Richards? Uh-oh, she froze.
Mm.
Hopefully she comes back.
Mr. Johnson, we will have the second layer, which will be in the classrooms. So the teachers can still see what the students are doing once they return from the restroom.
But small children need to be supervised when it goes to the bathroom, though.
Yes. But
Yes, they're
Mr.
talking about the preschool.
I'm sorry.
Yeah.
I'm thinking logistically, the bathrooms are all located very closely to every preschool class,
Okay.
with the exception of perhaps one or two preschools, but the majority of the preschools have bathrooms located right next to the classrooms, or even inside of a classroom. They're almost like an ensuite.
Okay.
Small facilities.
Yeah.
And the other
Right.
thing I would just say in summary to that is that we're creating new norms and helping young people and young children with their new norms and the new behaviors around that. So that's what really is being established. And, you know, young children are usually ripe and ready for the learning, and providing that opportunity and modeling that will be really important. And they're one, and when it comes to hand washing, and I think I've said this to the preschool administrators, they really are the model for very good hand washing habits, and the preschools have done an excellent job with that. And this will be pretty much doing what they normally do.
Wonderful. Mrs. Richards, you were froze for a bit there, but we're going to have to go. To our audience on Facebook, tune in again tomorrow. There are some questions I didn't ask because they weren't directly related to the safety issue, but we do see, you know, obviously your questions remain on Facebook. Um, so it's not like we're all going to pretend the questions aren't there. Tune in tomorrow. We'll continue the conversation tomorrow. Thanks a lot to our panel. I really have actually enjoyed this. And we hope to see some of you all tomorrow.
Tomorrow.
Thank you very much.
Thank you.
Thank you.
Thank you.
Good.
Thank you.
Good night.
Good night.
Thank
Oh, where is it?